I told you I'd be back. All right. So what we're going to do now is we're going to do the first part of the Critical Access Hospital Awards. So each year we've been doing this for about 5 or 6 years now, where we give out awards to everyone based off of a couple of different criteria. It's changed year to year, but this year we've got, I believe it's 7 awards and 8 awardees. We had one where we really couldn't pick between the two because they both offered such different specific things, and we'll get to that when we get to it. But to start it off with, we actually have an award that we wanted to discuss that is not one of the ones that I'm going to be giving. Joyce Fillenwarth, who's also helping me out with doing this, got an award herself, and so we wanted to talk about that first. And so my boss, Aunt Allie, sent me a little message that she wanted me to say before I pass it off to her to talk about it. So the Indiana Department of Health congratulates Joyce Fillenwarth for receiving the National Organization of State Offices of Rural Health Advocate Award. This award recognizes State Office of Rural Health or individual who has demonstrated exemplary collaboration with stakeholders or partners to raise awareness of state offices of rural health, NOSOR, and other rural communities. So Joyce was nominated for her tireless dedication to finding funding for rural health programs, connecting individuals in rural communities with programs and resources, and for bringing the state office to a higher level of production and efficiency as she juggled multiple grant programs while volunteering at the COVID call center. So we're grateful for Joyce's contributions, and we wanted to share our thanks with the group. And so I wanted to pass it over to Joyce see if she wanted to say a few words and kind of surprise her that we were talking about this first.
Well, I've been surprised now twice, and for those that know me, I'm always at a loss for words, and that's not who I am. I really appreciate the nomination and was so shocked when I was announced at the NOSOR annual conference and even today. So thank you. I appreciate Ann's nomination and for NOSOR for the acknowledgement, and just hope to continue with David to continue to bring the obstacles and the barriers that we know you all face in rural and all your successes to the forefront, and to continue to support you. So thank you.
All right.
Joyce, there are a few of the Critical Access Hospital convening partners, and we have a video we would like to share with a congratulations to you. And it'll take just a couple of minutes to get it set up, or a couple of seconds, really.
Congratulations, Joyce. You are incredibly deserving of the National Office of Rural Health Association Advocate Award. You've always been an incredible promoter of rural health initiatives. Thank you for your commitment to always keep a pulse on the rural health landscape and identifying areas that demand focus and attention. It's an absolute privilege to work alongside you as we address rural health together. Congratulations.
Joyce, our K-Source team is so excited to hear about this award that you've received. You've been a true partner to us, helping us identify meaningful opportunities for collaboration, introducing us to new partners. So congratulations on receiving the National Organization of State Offices of Rural Health Advocate Award. Very well deserved.
Joyce, we are so proud of you. You're such a great advocate for rural health here in Indiana, and we know that advocacy is such an important part of public health. So again, just congratulations.
On behalf of the Indiana Hospital Association, congratulations to you, Joyce, on being named the recipient of the National Office of Rural Health Association Advocate of the Year. As I reflect on the definition of advocate, is a person who publicly supports or recommends a particular cause or policy. You exceed this definition, Joyce. Please know how much you are appreciated throughout the state of Indiana, as you work each and every day to fulfill the mission of the Indiana State Office of Rural Health, which is to enhance the growth of public health services, funding sources, and educational opportunities for every Indiana rural resident. The Indiana Hospital Association greatly appreciates the partnership we have with you, Joyce. And again, congratulations on this well-deserved award.
Oh, thank you, Becky, and the group for putting that together. So if I stay on, I'll start crying. So I'll pass it on to David. Thank you.
All right. So that was kind of a nice way to preview what we did this year with the Critical Access Hospital Awards, where in the past, during these video conferences, we've announced them during it, but we haven't been able to hand the plaque over to people. So what we did this year is over the past couple of weeks, we've actually traveled to the hospital's locations or wherever they wanted to meet us so that we could give the people who received these awards their award in person, and we were able to record it. And so we'll be able to share that with you today. We've got them broken up into a couple of different videos. But for this first one, it's going to be giving out the Critical Access Hospital Hero Award that was won by Jared Sterrett over with Franciscan Health Rensselaer. And then also the Patient and Family Experience Award, which was won by Zach Beiswanger over with Cameron Memorial Hospital. So I will pass it off again and we will play that for you.
So, like I said before, I'm with the State Office of Rural Health. My name is David Conrad. And one of the things that we do each year is we give out awards to critical access hospitals and individuals so that we can award people that otherwise don't get recognized a lot of the time, because up at, the urban level and stuff, a lot of times rural stuff just kind of falls by the wayside. So when I came on to do the Flex program, which I'm doing, one of the things we started up on was giving out awards to people. We've been doing it for about 5 or 6 years now. But this year we're doing a new award called the Critical Access Hospital Hero Award. And so we received a submission for you. And for us, the thing that really jumped out was the fact that you've taken such an initiative in helping one of the biggest problems in rural, which is staffing, and making sure that new students want to come into rural and stay in rural. And so for that, and for all the work that you've done with Ivy Tech, as you can see, lots of people here today came out to show their support for that. We would like to present you, Jared Sterrett, with the Critical Access Hospital Hero Award.
All right. Well, thank you very much. So I've received this Critical Access Hero Award. Very exciting. At first, of course, I was a little skeptical of whether I really deserved something like this. Is it possible? I would have said that I was just doing my job, trying to educate people, try to connect with people. But then I do have a history of working with folks. I have a folder of information. I have a box of toys. And it is well known that I have an endless supply of stories, things that I learned the hard way. And I would just hate for people to have to do that themselves, to start all over again. And so connecting with students is a great experience and a great way to advance the field of respiratory care.
I just want to say thank you on behalf of Franciscan Health Rensselaer. We are very honored to have this year Critical Access Hospital Hero. Something that we have recognized through many years. Gerald has been a mentor for well over 25 years, and it's good to know that the rest of the state and the Critical Access Hospital world will actually know what we have known for over 2 decades. So thank you, and I just wanted to say that the power of rural medicine is in our people. We don't have the resources to do anything on the marketing, so especially when it comes to recruiting and retaining our force and attracting our workforce depends solely on people like Jared Sterrett. So thank you for recognizing that.
Hi, my name is Richlyn Rice, and I'm the Director of Clinical Education for the Ivy Tech Lafayette campus. We were asked to provide some information regarding Jared, and I can say that all of our students, when they come back from a rotation here at Rensselaer, they are excited. He puts a light in their eyes that a lot of places don't give the students when they leave that rotation. He works with the students, he asks questions, he works on material that maybe others, things that they don't understand. We are happy to support Jared. He's always the first to let us know when changes are occurring out in the field that maybe we don't get news of in the classroom. Jared is just a key resource for our program. So we are happy to be able to partner with the site and have our students come here and hopefully have them apply as future employees. So, and what an honor, Respiratory, getting an award like this. So happy that you were able to support our field. So, yes.
My name is Bria Siegel, and I'm an Ivy Tech student in the respiratory therapy program. And I nominated Jared because he really stuck out to me and really took the time to try to explain things to me and got machines out when they were not even in use and was getting them running and showing me, how to run this machine and how to better understand what we're doing to our patients to better their health and bring them back to health. That's why I nominated Jared.
And thank you very much for doing that.
You're welcome.
So hi, my name is Gabe Kirkham. I'm a second year respiratory student, and I had Jared as a preceptor here. And not only I had him, but my mom, who's a respiratory therapist, had him as well. So training 2 generations there, just kind of cool. But one thing that really stood out to me was how engaged he was with us. And I guess I was the only student here at the time. It wasn't a 2-person time, but the fact that he took time out of his day to help and kind of make it a positive workplace really stood out to me and made me want that to be like where I work at in the future. I want it to be kind of like that.
Jared, on behalf of the staff, I just want to wish you congratulations on your well-deserved award. As many people know, you not only mentor students, but your own department. If we get any new equipment or if we have our frequent problems in Epic, you're always happy to get in there and help. Your patience, of course, is legendary throughout the hospital. And because of our short staffing, oftentimes we'll be busy in the ER up on the 3rd floor. And even though you're in the middle of doing meetings and all your work as a manager, you're always happy to stop, help, throw on your lab coat and come up and give us assistance. And your staff definitely appreciates it. Congratulations.
So I am David Conrad. I'm from the State Department of Health. I work with the Hospital Association very closely. And what my role is I am the Flex Grant coordinator. So what the Flex Grant is it's the short bit of it is basically it's what gives the critical access hospital designation. And I receive funding from the federal level to make sure that we can provide training to critical access hospitals. So one thing we started when I first came on, like 5 or 6 years ago now, it's been a lot longer than I realized. Anyways, one of the first things that we did was we really wanted to start giving out awards each year so that we could show the hard work that goes in at these hospitals. Because oftentimes at the urban level, I'm in Indianapolis, so I work with a lot of people down there, but they don't always get to hear all the great stories that go on at our critical access hospitals, at our rural hospitals. And so it was really important for me that we kind of got to showcase that. So this year we increased the amount of awards that we were giving out. We had 5 in the past, we moved it up to 7 this year. And one of those in particular is the Indiana Hospital, Critical Access Hospital Association Patient and Family Experience Award. We've done something that was kind of more data-driven specifically in the past that looked at data everyone had done, but we felt that it didn't kind of really get at the heart of the situation, especially with the ongoing pandemic and with all these things. People's experiences at hospitals is really important. That's what keeps us open, is what keeps these things going. And so today I'm here to give an award to Zach. I'm going to butcher the last name, Beiswanger. When we got all the awards in, and we've gotten a lot this year, it's the most that we've received. Since this was a new award that we're giving out, this was, for me, kind of exemplify this award, what Zach has done, to take such a tough situation as a pandemic to, kind of be the face, work with the patient specifically, make sure that they were getting to interact with their families by voice chat, by different ways, because we were all just kind of, flying by the seat of our pants, figuring things out and making sure that these needs were met was not easy, I feel. I think it's something that gets overlooked a lot. So today I want to make sure to give Zach, to show him that we noticed, that we saw it at a level, and the review that I got was just glowing. It was very impressive. So if you come up here, please. Thanks.
I nominated Zach for the Patient Experience Excellence Award because in my mind, he was the perfect candidate. Zach goes above and beyond for our patients at Cameron, but not only our patients, but their families too. He has done immense growth as far as implementing lots of programs that involve families and patients. For example, the TCU program that we have at Cameron, he implemented so we have multidisciplinary rounds. So all of us are in the same room, inviting their families to attend as well, so that they are up to date on all of their care. But some of the most important things that I think Zach has done are the little things that go above and beyond. So he sends cards to every patient that discharges from Cameron. He rounds on every patient to make sure their room temperature is good, that they don't need something to drink. He's willing to help them out however they need. One of the most important stories about Zach is that he took the time to bring in cornhole boards to play with a patient who had been at Cameron for a while, pretty sick. And one of the things he missed the most was playing cornhole. So Zach took it upon himself to bring in cornhole boards and play with him. Zach lost, of course. But Zach is just a very kind, compassionate person. So there was no one better to win the award.
So I'm honored to accept this award on behalf of Cameron Hospital. I really feel like this isn't an individualized award. This is a team award. I feel blessed to be a part of our organization. I feel blessed to be put in the position that I'm in by our leadership team, where the emphasis is on patient care and doing anything possible to provide our patients with the absolute best experience possible. So I'm very honored on behalf of Cameron Hospital to accept this award, and obviously, Sierra, just really appreciate the recognition and obviously serving with you every day. So thank you so much. So.
All right, so that was the first award, the first video that we had. We're going to run another one here before we wrap up for this first session of awards, and we'll have one more later on today. But for this next one, we are going to be giving out the Outstanding Rural Health Provider Award to Dr. Lucy Clunie over with Harrison County Hospital, but also both of our Community Impact Awards. Each one of these hospitals that we're going to have videos play for had a unique take on how they were helping with their community with everything going on. And when it came down to it, I was really struggling to pick between the two of them, and spoke with Becky Royer, and she's like, well, why don't we give it to them both, since they're both tackling such different problems? So along with the Outstanding Rural Health Provider Award, this next video will include the Community Impact Awards we're giving out, one for Union Hospital, Clinton, and one for IU Health Bedford. So we'll go ahead and get those started. So, as I was mentioning before, with the Flex program, one of the things that we like to do is give out awards to people who exceeded in one way or another. We have like 6 or so different awards that we give out each year. And we do this because it's one of the best ways of the state for us to acknowledge all the hard work that goes on at the critical access hospitals. Because a lot of times, a lot of the work here goes unnoticed by people up in, in the urban areas, at the state, things like that. And so, for me personally, this is one of my favorite things I get to do each year, is to get to acknowledge all of the hard work that goes on. And so the reason that we came down here today is that we wanted to give you an award, actually. The award that we're giving you is for the Best Outstanding Rural Health Provider. And the reason that we want to do that, so I get submitted multiple different awards each year, people sending stuff in, and Gloria sent in a recommendation for you, and it just kind of was really, really impressive for me. The fact that
while we've been going through all of this, everyone obviously is struggling with COVID, everything going on and stuff, but for you two have stepped up and kind of been the face for this place to make sure that people felt reassured and that they could have the information that they needed. And then not only that, but to kind of step up and take over as CEO during all of this whole kind of crazy thing. It really stood out to me. I was really impressed. And so we wanted to give you today, Dr. Clunie, I said that wrong, I'm so sorry, the award for Outstanding Rural Health Provider for this year.
Wow. Very humbling. I mean, it takes a village for sure. We have had a phenomenal team and continue to have a phenomenal team. So I'm proud of our hospital. I'm proud to be a critical access hospital and be a small part of what we accomplish here. So this is amazing. Thank you for being here and thank you for the award. Thanks to everyone here.
Well, it's my pleasure, again, as a State Office Rural Health Manager to come and present to you this award. We do have a write-up, so I have not memorized it, but I will just kind of hit some highlights. What this award represents is that we do this every year. We go through and we ask that we receive applications that recognize individuals, hospitals that have really excelled, especially in the last few years with the pandemic, on really trying to make an extra effort to do something special for the patients that they serve. And so we're so happy to be able to present this to Union Clinton today. I really can't outdo what Stephanie's already shared with you, but I would like to share with you that when we looked through the applications and we looked at yours, we saw that one that, as you know, your primary access is to serve the community members of Vermilion and Park County, and just such a high rate cardiovascular and stroke incidents that occur in these counties. And the way that you responded and worked to obtain a grant funding, we know applying for those grants is not easy and it's very time consuming, so we so appreciate the extra effort that you took to take advantage of that opportunity. And we recognize that you're only one of 7 hospitals with the designation as being stroke ready, and that's just awesome for a critical access hospital to have that. So we're so proud to be able to represent you for that. What's also impressive through this work is just the increased awareness that you've created in your community. As Stephanie shared earlier, you know, the marketing efforts, talking the talk, just really making people, you know, aware of that. This isn't in here, but I had my husband go, we're in Hendricks County, when that was being offered in our community for a heart scan. He's 56 and his father had his first heart attack at 35. And I was just like, you have to go do this. So just really reinforcing that to everyone. I just really appreciate your efforts in letting just the common people know that, you know, the importance of this, to be on the side of prevention, you know, and not have being in more of a catastrophic situation. And so we recognize too that improved health outcomes for your community. And again, as I shared, despite the pandemic, and we also recognize the workforce challenges that you have, that this led you to being the recipient of our State Office Rural Health Critical Access Community Impact Award. So congratulations to all of you. Thank you.
Hello, my name is Willis Losi. I've worked here at Union Clinton for 15 years now. So I've gotten to see a lot of the growth that has occurred at this facility. I started out in the emergency room and then progressed to a house supervisor. So currently my job is kind of roaming around putting out fires. I've also accepted the position of stroke coordinator, which pertains specifically to this award. We've gotten to see our stroke times cut literally in half. We're still working to improve those, to bring them down even faster, all geared towards preventing the devastating consequences of stroke that take away people's ability to speak, ability to eat, walk, just live life in general. So we're trying to reduce that impact on our community. We're making fantastic strides in cardiac care as well. We've opened up a Suite 200 here in the last few years, which has allowed us to get Dr. Namburi in our doors, which is fantastic for our community. It's fantastic for our patients. we are offering heart scans, which is a way to kind of get ahead of a cardiac event before it happens, so that you can understand what your risk is in developing a cardiac event. So this reward is a reflection of the work that we've already done, but we're going to be continuing to work even harder to improve those times, to get them just the best that they can be, and try to be on the leading front of stroke and heart care. We have a lot of telemedicine programs that have been fantastic for us, which has allowed us to bring more resources into our area. One of the things we like to try to keep in mind is that it's not easy for everybody to make that trip to Terre Haute, not easy to get to Indianapolis necessarily. So these are all ways that we can kind of keep things here in-house and take care of our local community, which is very important to us.
She was doing a talk on the new, some new things that they're doing at the hospital, and she talked about a cardiac scan and how a 36-year-old came in that thought he was perfectly healthy. They did the scan the next week, he had open heart surgery. So I kept thinking I was getting a little bit short of breath. So I thought for $50, that was such a deal to do the test. So I called and made an appointment. I got in the next week, came in for the scan. It was over in 45 minutes. And at the end of 45 minutes, they gave you the results of the test, which was the best. I mean, that's great that you get it right away and don't have to wait a week to hear. So as soon as I got the results, it was bad news. It was the worst scenario that could be on the paper. So I went back and called my doctor. They got me into Dr. Desai, and he read the report. And the next Tuesday, I went in to the hospital for surgery. I had an angioplasty and ended up having 2 balloons and 2 stents placed because I had blockage.
So Melissa's score was very high. It scored in the range of excessive evidence of coronary artery disease. So left untreated or left without any sort of intervention, she could have eventually ended up having a complete blockage and eventually having a heart attack, which could have led to lasting heart damage.
And I'm very active, so I didn't think they would find anything. And boy, they did. And I'm so glad that I came in and did that. I work at the nursing home here in town, and several people, we've talked about it. They've come down and made appointments to have the scan because I'm telling everybody they need to come down and do it, because for $50, it's worth to give you the peace of mind that you're doing okay.
So, my name is David Conrad. I am here from the State Office of Rural Health. And one of the things that we do each year with the Flex Grant, which is what I work over, is we like to give out awards to critical access hospitals that I work with. So we have about 7 awards that we give out each year. And for this year, for the Community Impact Award, we wanted to come down here to Bedford because we received a very, really great entry that talked about everyone's, how we adapted during the COVID response. Now, obviously, COVID has been a huge problem for the community. So something that took it at such a level and really showed your guys' ability to adapt to such a tough situation on the fly was something that really stuck out to us. And so this year, we wanted to present the Community Impact Award to IU Health Bedford for you guys' ability to live up to that.
On behalf of IU Health Bedford, we are so honored to receive this award. We are so committed to this community, and I'm thankful to be a part of this team.
All right, so that will wrap up what we've got planned for right now. Is there anything else, Becky, that I missed?
Yeah, there's a video for IU Bedford
Oh, that's right. They have their own personal video they put together.
Yes.
So we'll play that next as soon as we get this finished putting together.
Just to make sure that they have gotten the best care that they possibly can while they're here at IU Health Bedford.
I've been taking care of COVID patients in the ICU since February of 2020. And there's been a lot of death, unfortunately. You know, as doctors and nurses and in healthcare in general, especially working in ICUs, we deal with death a lot. COVID, however, really affected me personally, and I think I can speak for a lot of my colleagues a little differently because, you know, we were seeing a lot of death, and particularly later on when we had good vaccines, we were seeing a lot of preventable death, and that was really hard for us to see. There was a point, you know, especially with this last surge, where basically every hospital in the tri-state area was completely full, and our ER was overflowing with patients. The Bloomington every ER was overflowing with patients.
You know, we're going in these patients' rooms for 12 hours at a time, you know, looking at patients and knowing that we truly can't do any more for them. There's certain things that kind of evolved in the traditional care for COVID patients that we weren't able to do here at Bedford. So in those scenarios, we would call hospitals, not only in the state of Indiana, but it got to the point where we were calling surrounding states as well, and we just could not find ICU beds for those patients. I would say our doctors really initiated this push that we can do more here.
There were specific critical care procedures, such as proning and musculoskeletal paralysis, that normally aren't performed at a 6-bed ICU critical access hospital.
Our nursing manager, as well as our respiratory therapist, got us the education that we needed to be able to do more for these patients, because we truly wanted to give everybody the best chance possible to beat this. We partnered with IU Health Bloomington, and their clinical nurse specialist, as well as their educator, came down here and actually provided classes for us with some hands-on experience. And it was a very quick turnaround time for that. So they came here very quickly, we got the education quickly, and we implemented it to help patients all within like a week's time.
We started proning basically right after we learned from the nurses in Bloomington. Chris was like one of our very first COVID patients that we started to prone right away after we received training.
In the morning, they would turn her on her back at like 8 a.m. and then they would keep her on her back until 4 p.m. And then at 4 p.m., they would flip her over to her stomach, and she would be like that until the morning.
The overall outcome we saw with Chris was extraordinary, and I think everyone was extremely happy to see how much proning actually helped her.
I feel almost like a miracle. I feel like what they did here was a miracle, and the fact that they were trained to do that just a few weeks before I caught it is amazing. I really think that when you can get it right here in your hometown and then have all of your supports here at the same time, that's a much better situation.
So I kept a journal just so I could look back and kind of see where we were. So I just wrote down like when I called, the date, the nurse I spoke to, and just kind of the statistics they gave me. You know, and then plus I wanted to show her whenever she got out how much she overcame. First thing I said to her is, "You did it, Mom. I love you. You are the strongest woman I've ever known."
I'm rested now. I'm ready to go. And it all started here. The staff here was just amazing.
Everyone really just stepped up. They knew it had to be done, and I was extremely proud of the team. The fact that we were able to prone her here and not wait several days for her to be transferred to, Methodist or Bloomington or somewhere else, then prone her, I think saved her life.
There's nothing more than we want to see than for them to get better and go home and be with their families and to see them out in the community versus here at the hospital. If we can do anything for them, it's just to make sure that they have gotten the best care that they possibly can while they're here at IU Health Bedford.
All right, so that wraps up the videos that I had put together for my Critical Access Hospital Awards for this session. We'll be doing a few more later on today, but we do have one more award to discuss before we wrap this up and move to break. So I'm going to pass it over to Joyce so that she can discuss the Star Award for this year.
Thank you so much, David. I'm here today to talk to you about an award called the Community Star Award. This is an award that actually comes from the National Organization of State Offices of Rural Health. And at the time we sent out the nominations for the Critical Access Awards, I also requested that our hospitals look at potential nominations that they might like to make for this National Community Star Award. And this award recognizes individuals who are making a difference and positively impacting their communities and health-related areas. So what happens is that the nominations are received and I submit them up to the National Organization of State Office of Rural Health, which is referred to as NOSOR. They interview all the nominees and then select one community star from each state. So this year I was so excited because we had 4 nominees and I was so grateful I did not have to make the decision. But our nominees were Chris Butler, the CCO and CNO of Adams Memorial Hospital, Jessica Clifton, who's the Clinical Process Improvement Coordinator with Adams Memorial Hospital, and Brittany Kelly, who's a community health worker for Sullivan County Community Hospital, and Brian Herwig, who's CEO of Perry County Memorial Hospital. So first I want to say congratulations to all these nominees. We just recently found out this news, so I'm going to be going on site and presenting everyone with the appropriate plaque. But I'm excited today to share with you that NOSOR did select as a community star Brian Herwig. So I just want to share with you a few of the highlights that were included in Brian's application, which was submitted by Elizabeth Burrows of Burrows Consulting. He's a development of the 13th Street Clinic Women's and Children's Center, expanding their OB and GYN services, increasing the number of providers in the clinics, expanding services into the Spencer County community by opening the Spencer County Clinic, a rural health clinic. He also participates on the Perry County Health Department Board and the Perry County Behavioral Health Coalition. And while in the coalition, he saw the need for expanded access for behavioral health services and developing a plan, which is in the works, to hire a licensed clinical social worker to do the outpatient behavioral health within Tell City Clinic. Continues to work with pediatricians on the vaccines for the children's program and attaining grant funding to bring all Perry County providers on the Indiana Health Information Exchange. So again, it's with great pleasure that I announce Brian Herwig as Indiana's Community Star Award. So congratulations, Brian. I'll let you say a few words, please.
It's a great honor to be recognized by the national office and the state office for work that you love. Working with the local community to build stronger healthcare systems in partnerships with the local community, regional partners, and state partners. So thank you. I have a passion for small and rural healthcare and enjoy the challenges of developing new delivery models, expanding services, improving access, and delivering quality healthcare. And so thank you. I am pleased to recognize the entire care team at PCMH for recently being recognized by CMS for being a 5-star provider for patient satisfaction. And the 5-star and the Community Star Award would not be possible without the support of a trusting and tenured board, excellent physicians and providers, a great management team, and the skill and dedication of every employee. So thank you for this award. Thank you, team. It's a great day. Thank you.
Thank you so much, Brian. Well deserved. So we'll be down, I think, in the end of November. I think we're coming down to do the presentation. So I'll pass it back over to Becky again.
Thank you, and congratulations to all the award winners. Everyone's very deserving, and all of the hospitals deserve an award of one manner or the other because of all the great work that's been accomplished over the past years, despite all of the challenges that have been faced. So congratulations, everyone. So at this time, as we get ready to kick off our first break for the day, we're going to ask